Okay, Dr. Mehta, you can begin.
Welcome, everybody, to Spine Time, Weill Cornell Medicine Center for Comprehensive Spine Care's free webinars with back and neck experts here at the Comprehensive Spine Center. I am your host, Dr. Neel Mehta, and I've met many of you before. Welcome back. Today, we'll be speaking about understanding spine anatomy. Really, what are the structures? How do they affect how you move? And what causes pain and other impairments? As you know, this is Spine Time that was created during the early days of COVID as part of our mission to continue to engage with patients and friends and to educate our population on various topics about spine. It's part of the Center for Comprehensive Spine Care located on 59th Street and 2nd Avenue, where we have multidisciplinary care going on every day, including spine surgery, pain management, rehab medicine, neurology. Today, I'm joined by two of my dear colleagues, Dr. Abhilasha Solanki, an assistant professor of clinical anesthesiology and a doctor in pain management here at Weill Cornell, and Dr. Vandana Sood, an assistant professor of clinical rehabilitation medicine. And together, they're going to walk us through what we need to know about spine anatomy. So, Dr. Solanki, Dr. Sood, thank you for joining us. First, we'll start with Dr. Solanki. But before we do that, just to remind everybody about our opportunity to engage with us, there is a chat function, and please type out your questions there. We'll do our best to address them as they seem relevant for discussion. And if we don't get to everything, certainly send us a note. We can also share what we will do for appointments in terms of calling our center at the end of our talk today. So with that said, Dr. Solanki, I turn it over to you. Walk us through what we need to know about spine anatomy.
Thank you, Dr. Mehta. And thank you to the audience who's taken time out to come and join us on this webinar. So as we all know, the spine is basically a big physical support structure that essentially helps us hold up our heads, our neck, our upper body. It's the reason why we're able to stand up straight, and also the reason why we're able to turn, bend, and just move around. So let's have a look at what it looks like from the inside. So if you look at the picture on the left, that is what the spine would look like if we were to look from behind ourselves. It's basically a structure that starts right at the base of your skull and goes all the way down up to the hip region. And it basically is composed of bones, nerves, muscles, ligaments, and intervertebral discs. Now, there are 33 vertebral bodies, essentially bones in the spine, and they are classified into 5 different regions. The one that is up top is in the neck, which is called the cervical region. That is composed of 7 of these vertebral bodies. Next is the thoracic vertebral level, which has 12 bones. The one right beneath that is the lumbar vertebral body region, which is essentially 5 bones put together. The lowest part of the spine is formed by fusion of these bones. The triangle-shaped bone that you see over there is called the sacrum, and right beneath that is the coccyx, which in simple terms is called the tailbone. Now, if you were to look at the spine from the side, it basically has certain natural curves. The one in the cervical region and the lumbar region is called lordosis, and the one in the thoracic region is called kyphosis. Very important thing to remember is that these are natural curves, and when obviously they're exaggerated, patients can have pain. Now, as you can see, there's lots of bones, right? So each one of these spinal segments essentially has a bone that has a hollow opening at the back, and when these bones are stacked up, pretty much like coins stacked up, these hollow openings form something called they form a hollow canal, which is called the spinal canal. And the spinal canal has a very, very important role in our lives. It basically keeps the spinal cord safe. And we all know that the spinal cord is nothing but, the highway from the brain up to our body. So it's the basic way in which the brain communicates with the rest of the body and the body communicates back with the brain. So as you can see, the spine has a very, very important role. Now, if you were to look closely, we can move on to the next slide. This is how the cervical spine looks like. So as you can see, there are 7 bones, right, numbered from top to bottom. At each level between the bones is something called an intervertebral disc. And on the side of each of one of these bones is a hollow opening that allows nerves to come out of the spinal cord. Those are the ones that you can see in yellow. The vertebral bodies communicate with one another by means of small joints. These are called facet joints. And the spine in general, this bony part, is stabilized by ligaments that are present in the front as well as at the back. And outside of that is are the muscles that you can see over here. Now, similarly, when we look at the thoracolumbar spine, which is, the upper back, the middle back, and the lower back, we have the same structure. Vertebral bodies. In between the vertebral bodies, there is a disc. And at each level, you can see nerves come out of the spine. And once again, these are stabilized by ligaments that are present in the front as well as the back. And on top of the ligaments are the muscles. If we were to look closely at a segment, we can look at the next slide here. You should be able to see the spinal cord. That's the big round yellow structure on the top. And the spinal cord gives out these spinal nerves that you can see coming out of the small openings in the spine called the foramens. Now, the intervertebral disc is basically composed of 2 things. It has a tough outer ring and it has a soft inside. And it's the tough outer ring basically which prevents the discs from moving much. Now, the purpose of the disc, as we all know, is to basically act like a shock absorber, pretty much like, something that prevents the spine from becoming unstable. Over time, the inside of the disc, which is the soft portion, can start losing water. And that's when we initially start getting, disc degeneration. And over time, there can be disc herniation, which is often, termed as bulging discs, like layman's terms. When that happens, as you can see in this picture, the bulging disc can sometimes irritate nerves coming out of the spine. And as a result, you could have pain, you could have numbness, occasionally muscle weakness as well. And this is something that you often go to see the pain doctor for. Okay. Now, the last bit of the spine is called the sacrum and the coccyx. So as you can see, the sacrum is this triangular bone, which is in the lowest part of the spine. It is formed by fusion of sacrovertebral bodies. And on either side of this, you can see a big bone. That's the ilium, or the iliac bone of the pelvis. Typically, this is a very stable joint. Basically, the sacrum communicates with the ilium on either side. And usually, as long as your movement is stable, this joint doesn't get irritated. But anytime there's an imbalance in the body, the ligaments which support this joint can get stretched, sometimes weakened, and then we essentially get pain. The lowest part of the spine is called the tailbone or the coccyx, which you can see at the very bottom of this picture. That usually gets injured, when we have a very sort of significant fall and where we fall down on our buttocks. But other than that, it's fairly asymptomatic.
Vandana, walk us through some of the muscle structures here.
Sure. So in addition to the bones, the joints, and the nerves that Dr. Solanki pointed out, we have dozens and dozens of muscles that are involved with providing support to our spine as well. These are really critical because they provide support and they absorb a lot of the stress that our spine is otherwise exposed to. The stronger the muscles that you have around your spine, the better we're able to protect the deeper elements of the spine, such as the bones, the joints, and the nerves. And we're going to move on to the next slide. So now that we have a good sense of the anatomy, we're going to talk about how the spine moves. Our spine is able to twist and bend in a few different directions, and we do this constantly as we go through our daily activities and also as we engage in a lot of higher level activities or sports. Range of motion of your spine and overall flexibility is really necessary for us to be able to move easily and also to prevent us from getting injured. On our next slide, this graph actually does a great job of showing the different amounts of pressure or stress that certain parts of your back, particularly discs of your back, are exposed to as you move through different positions. So you can see here on the very left, you can see that the person is lying straight, and that's the least amount of stress on your spine. But then as you get up and you stand, the pressure goes a little bit up, and as you bend forward, as you lift something heavy, the pressure starts to build. This is a good reminder of how, depending on how our body is positioned, can significantly change how much stress our spine experiences, and is a good reminder that we need to keep changing positions over the course of the day. This is also why we recommend that when you lift something heavy, you keep your back straight and your muscles engaged, because bending forward and lifting something is definitely a lot of stress across the discs of your back. Next up, we have here the facet joints. This is something that Dr. Solanki mentioned as well. And these are the joints that are on both sides of your back, on the back end. And these joints are also very commonly overloaded. When that happens, you get an irritated joint, which you can see in the picture here, and that can cause a lot of pain. When these joints tend to be overloaded when you are bending backwards or when you're doing some sort of twisting motion. And strong muscles can be equally helpful here in supporting these joints and minimizing the stress that they experience. In order to support our spine, it's really helpful to have some exercises that help build this muscle strength. But we know that some exercises can actually increase stress across the spine. So if you're looking for exercises that are going to support your back without providing a lot of stress, these are some great starting exercises to consider. All of these exercises keep your back very straight and very neutral, but still help you build a lot of strength in the surrounding muscles. And on our next slide, we have some good examples of flexibility exercises. So strength of the muscles alone is not enough. We need to make sure that our spine is flexible and able to move in all the directions we need it to. And so here are some good examples of exercises that can help with building and maintaining flexibility across your spine.
Fabulous. I mean, this is a great overview of sort of the purpose and structure of the spine and ways to kind of exercise them and develop flexibility. So let's talk about, just for knowledge sake, how did you guys learn about the anatomy? Obviously, you went to school, but what's been the best way to kind of appreciate and now translate your knowledge of anatomy into your clinical practice? How did you go about doing that?
Oh, well, you're right. You know, we learn about the anatomy of the spine as medical students, but I think for me, it was during my training as an interventional pain fellow that I kind of really understood not only the anatomical aspect, but essentially the functional aspect of the spine too. So it kind of started there. And now that we are able to translate that into clinical practice, I feel like a lot of the theoretical knowledge has become practical knowledge. And it's just that the more years that you've spent essentially treating spine-related pain, you know, the better your understanding gets. Obviously, there's continuous learning involved.
I agree.
Dr. Sood, how did you sort of apply what you learned, and how have you evolved in your knowledge?
Agreed. I think a lot of the basics come from knowing the anatomy, and that does take a while to really absorb because there really is so much going on in our spine. But once you get a grasp of what's there and all the different parts, it really, I think seeing patients in person, and particularly for me working with physical therapists who are really exercise experts, has been super, super helpful in really understanding what exercises can be effective and maybe which ones aren't the best option for someone who's in pain. So for me, I think it's been a combination of working with patients and working with physical therapists and all, all the surrounding, who we work very, very frequently with to kind of really understand what they bring to the table as well.
Yeah, great. Well, we're getting some really interesting questions in our chat, so I think let's turn to those. First question is, why is it that when my hamstrings are tight, my lower back pain is worse? Dr. Sood, I'll give that to you.
Sure. So when your hamstrings are tight, your back is sort of being pulled in the forces across your back are not perfectly aligned. So if your hamstrings are very tight, it's going to really cause more pressure on certain parts of your back, and you're not going to have the same amount of flexibility or the same amount of movement as you might normally have. And so definitely working on tight hamstrings is a big part of rehabbing the lower back in particular. You'll find that you have better range of motion in your lumbar spine, and your lumbar spine will also be compensating less for the tight hamstrings if you're able to loosen those. And often we find that it's not just about loosening the hamstrings. Sometimes the hamstrings are tight as a compensation. So interestingly, even though your hamstrings are tight, the approach often involves a lot of strengthening of the muscles that support your hamstrings. So if you have tight hamstrings, a good approach would be to really strengthen your glute muscles, strengthen all the other muscles that support your hamstrings, and they won't feel as tight because they won't have to compensate as much for muscles that maybe aren't as strong as they could be.
Got it. Much appreciated. Dr. Solanki, how can you distinguish pain in the lower back due to facet issues versus disc and nerve issues?
I think the first step in this would be to essentially get a very good history from the patient. Typically, when pain is coming from the facets, the usual complaint is that, patients have the worst pain when they wake up in the morning, after they've been resting for a long time. Facet-related pain gets worse when you try to extend your back, anything which requires extension. Anytime anybody has to walk for a prolonged time or sit for a prolonged time puts a lot of strain on the facet joints, and you really want to change positions. Typically, that's the history with facet-related pain, and it's usually localized to the center of the spine. Now, if it was a disc-related pain, during my presentation, I had shown like a small picture where you could see the disc herniation irritating the nerve coming on the side. So history-wise, patients usually will start complaining of lower back pain that seems to radiate down a certain dermatome. It can be associated with paresthesias, means like tingling and numbness-like sensations. They can be associated with motor weakness. Occasionally, there can be dysfunction of the bowel and the bladder also. But these are things that you would normally not see with facet-related pain because the etiology is very different. Facet pain is more localized, and disc-related pain or nerve-related pain follows the entire nerve dermatomal distribution. And then, of course, we have to do a thorough physical examination. On physical examination, we have certain provocative tests that we do to sort of elicit out, truly what is the underlying cause. And only after we get this, we do a comprehensive evaluation like this, with or without the use of imaging modalities, we can come to an underlying diagnosis of what truly is the cause of the pain.
Great. To either one of you, there was a question about abnormal muscles, like things like hypermobility or Ehlers-Danlos syndrome, where muscles can be particularly more flexible to the point of being abnormal, just to help define that for our audience. How is the spinal structure and function sort of affected in those patients, and maybe Dr. Sood, would you do the same types of exercises in those patients?
Good question. So for patients who already have a lot of underlying flexibility, which is many patients with Ehlers-Danlos syndrome, the emphasis actually shifts more towards strengthening and stabilization. So if you have good range of motion is good because it does prevent you from some kind of injuries. But if you have too much range of motion, you're generally speaking, your joints are a little bit less stable and everything's a little bit more prone to moving out of place. And so the goal here is to really focus on strengthening. You have the flexibility. Let's try to contain that flexibility by making sure your muscles are really strong and are able to support your joints as best as possible. So definitely, if you see someone who's very flexible, you're going to tweak the exercises a bit. If you see someone on the flip side who's super, super stiff, but is very strong, you may need to change some of those exercises there. And then it's also important to take into account the person's lifestyle. So it really depends on what you're trying to do on a daily basis. For some activities, you need more strength. For other activities, you may need a little bit more flexibility, like say gymnastics. So it really depends patient to patient. And I think this is why exercise does need to be personally tailored to a degree.
Great. Thank you for sharing that. Also to either one of you, there's an audience member that's talking about muscle spasm and scoliosis and how it potentially acts up and causes troubles in the SI joint. And so maybe you can tell us a little bit about the role of scoliosis and causes of pain there.
Right. So scoliosis, for the members of the audience who don't know what it is essentially an abnormal curvature of the spine. Typically the spine is straight, and in scoliotic patients there are curves. So if you can imagine, instead of being straight, if something is curved, some part of the spine is going to undergo a lot more stress than the others with specific motions. And so there is an imbalance in the spine. And as a result, the structures which support the spine, they undergo a lot more stress. And as a result, a lot of times when you have scoliosis, you start having musculoskeletal pain. It throws off the pelvis and the way you walk as well, which is why the ligaments that support the pelvis and the sacroiliac joint, they get stretched. And, you could start experiencing SI joint pain. And I think this particular audience member mentioned the fact that they do have SI joint pain related issues. It's something that kind of falls in that clinical scenario.
Great. Next question, what are the best sleeping positions for spine health? We did have a nice graphic that you shared, Dr. Sood, about some sleeping positions here. Is it safe to say that sleeping on your back is best?
So in general, I would say that sleeping in any position that's comfortable to you is probably the best, because good quality sleep is probably the most important thing. And to some degree, yes, when you're straight on your back is probably when your back is, it has the least stress, but that doesn't always correlate with everything that could be causing you pain. So I do think that there is some trial and error involved. Sometimes people have to switch pillows or mattresses. Some of my patients get relief with putting a pillow either underneath their legs or between their legs if they're sleeping on their side. So the short answer is it very much depends, but I think the most important thing is to do something that's comfortable, because if you try to force yourself to sleep on your back and you're not a back sleeper, you may not get very much sleep, and you also may not stay in that position for very long.
Great. Again, getting back to exercises, can you talk about exercises that are not good to do that could actually worsen spinal problems? And if anything that is related to those that have prior surgery like fusions, what can be more helpful there? And I realize that this may be very specific, so do your best to answer it.
Okay, so agreed. I think exercises definitely need to be tailored based on the specific person. And so for the example you gave with someone who's had a fusion, if you have a fusion, you have some metal inserted into your back that the surgeon put there for you to help provide some stability. And probably you may not have as much range of motion as you did before. And so it's important to kind of work with what you have. So you may not be able to get to extend all the way back or flex all the way forward. So I would recommend doing more neutral exercises. And the ones that I shared here are actually some good examples of that. And these exercises, I can't say that they're right for everyone, but generally speaking, these are safe exercises for people with spine pain because it keeps your spine neutral. It's not moving you too far in one direction or another, and it works to stabilize those muscles. But in terms of exercises that might not be good for some people, we find for people who have disc-related pain, say sit-ups can sometimes be super aggravating because it is repetitive flexion and extension. But a lot of this depends on what specifically is bothering you or what your specific underlying condition is. But I would say that the exercises here are usually a great place for most people to start.
Great. Well, we're coming up on to the half-hour mark, which is usually our time to wind down. I do welcome everybody to ask questions by making an appointment with either Dr. Sood or Dr. Solanki here or any one of our Spine Center team members. You can watch prior episodes of Spine Time on our YouTube channel, which is at youtube.com/Brain Spine Center. Also, we will be meeting again in 2 weeks to discuss with Dr. Hartle, myself, and one of our newest pain management faculty members, Dr. Jodwani, about virtual reality and augmented reality and its role in spine care, education, and surgery. So that will again be in 2 weeks, I believe, on August 24th, Wednesday, 5 p.m. right here. Thank you again for everybody's participation. Thank you to my co-panelists here, Dr. Sood and Dr. Solanki, and we'll look forward to seeing you in a couple of weeks.
Thanks for having us.
Thank you.
Thank you.